Good morning. Happy Friday morning live with Dr. Jen. So, most people think heart disease is about food and exercise, and why absolutely those things are very important. There is one thing that is one of the most powerful drivers of our heart disease, and it's something we rarely address. It's stress. And I know we talk about it, but we don't put enough emphasis on it. And recently, a study came out that demonstrated that African Americans have a lower longevity, higher mortality rate, less life expectancy due to stress. And stress is one of the things that we can't avoid, right? And it is Black History Month and it's also Heart Month. So I thought this is a perfect opportunity to address this we're going to talk about how stress affects the heart, not just in the short term, but over a lifetime, and why mindset, mindfulness, and joy are not extras, but actually essential parts of heart health. So, and if you stay with me to the end, I'll give you a tip that I use and I teach my patients. That's a little just hack that you can use to kind of start to reset this process. And it supports heart health even when life gets busy. So, welcome to Joyful Medicine with Dr. Jen. I'm Dr. Jennifer Davis. I'm a lifestyle medicine doctor, pediatrician, critical care physician, and I help adults and their families improve their metabolic health with evidence-based lifestyle medicine that honors real life, uh, culture, and humanity. And the goal is doing this without shame or restriction. So this space is about clarity, compassion, and what actually helps people heal. So let's talk about stress. So stress is normal, right? It's a normal part of life. Stress is what helps us get things done. But chronic stress, when it lasts day after day, year after year, it takes a toll. And often we don't even realize that it is affecting us or that we're feeling it. It may show up in ways like impaired sleep. You may have digestive issues. You may be very irritable and snappy. You may just be fatigued all the time. And these are things that we push through, especially as women. We tend to take care of our families. We want to make sure everybody else is doing well, but we often put our own care behind and our own needs, behind the needs of the family. But the thing is, chronic stress literally has a negative effect on our body. It can elevate inflammation. We know that they can measure elevated CRPs, IL-6, and other markers demonstrated to be elevated in people that have chronic stress. It can elevate our blood pressure. It can increase our insulin resistance or how our body processes glucose, which can make it hard if you have a disease like diabetes to have control. And that could be one of the reasons why you may not have control or why prediabetes may progress to diabetes, even if you feel like you're doing everything right. So stress is that hidden factor that we don't address. Blood pressure. When chronic stress shows up, it chronically elevates our cortisol. Our cortisol is our stress hormone. It's our hormone that we need in times that it's our fight or flight, right? So if we're fighting a bear, if we are escaping a disaster, we need our cortisol to be high. It at least lets our body have enough energy by releasing glucose. It elevates our blood pressure, it elevates our heart rate. And that's important in those times. But you know what? Our body doesn't know the difference between stress from an alert on our phone versus stress of a bear chasing us. So this is really, really important. So this is why even when diet and exercise are good and maybe your sleep is okay, but this stress is really working behind the scenes to quietly cause damage. And the thing is, if we don't reset, this stress continues to manifest in the background. Chronic stress leads to higher inflammation, it increases mortality rates, it increases our cardiovascular disease rates, which is what we're talking about here today. And it also is generational. We know that structural racism, which is one of the causes that in the African American community, Black community that we deal with, that this stress and trauma can be transmitted through your genes. It can cause, and we can pass that stress on, which leads our children and our children's children to be affected by chronic disease at a higher rate. It means that chronic disease is accelerated at a higher rate, where one person may have diabetes that is well controlled and they don't have sequela related to it. Another person may have very accelerated sequela, vascular changes and kidney disease and stroke and cardiovascular disease. And that's because this stress is quietly working in the background, causing trauma. So stress is from economic pressure, caregiving burden, lack of recovery time. And we can't separate these things from disease, right? These chronic stressors are a real factor in how we handle disease. And it's not about blaming, it's recognizing that this is here and how can we address it. So there are many things that we can do to address it. So the first thing is obviously if we're able to remove a stressor, if there's something that we can offload, we should do that first. But many times, like structural things like structural racism or working in a situation that's not ideal, we may not be able to avoid it, but we can affect how our body handles it and ways that we can do that. Um, so things like what we eat, right? We often, if we're stressed out, we may want to reach for that sugary treat as a comfort or whatever your favorite comfort food is, but recognizing that a lot of times those comfort foods don't love us back and actually may feed the systems. If you have that sugary treat, it's going to cause that immediate rush of sugar to your brain, and then that crash afterwards, what's going to make you more irritable. It's going to elevate your blood sugar. It's going to have negative effects down the line, but also it's not really suiting us, to help us heal, choosing something that is, well, making sure we're more resourced in the time. So focusing on nutrition over time so that we are providing our body with nourishing foods so that we aren't having those ups and downs. And that when we have a stressful moment, we're able to better handle it by maybe making better choices. But what we eat absolutely affects how our body handles stress. Movement. A lot of times people find that when they move, even if you get up and walk around, if you get up and take a break, this can help break the stress pattern. If you're in a stressful situation, sleep is absolutely important. And I know that if we are having chronic stress, sleep sometimes is elusive, but if we are able to sleep, that's a really important time that our body repairs from the stress that's going on. Our body does a lot of natural repair during that time, our brain, all of our other systems, so it's really important to prioritize that sleep. Connecting with other people, sharing, just having fun, laughing. Those things are important. And that connection, because we are social beings, we know that when we connect, that stimulates the happy hormones, oxytocin and dopamine, and all of those things are stimulated, which actually counteracts some of that stress that um, we are facing. I will say that wellness can be a stressor as well. I find it very stressful myself when I see all of these crazy hacks and things that we're supposed to be doing this much protein, this much that, you know, lifting exactly this amount, working out this many minutes. So I would leave a lot of that alone and focus on just general patterns of wellness, perfectionism, that strive to make sure every number is right, weighing ourselves constantly or counting every macro is really contributing to the stress. So if you've seen my prior videos, I talk about the basic things that we should focus on, and I encourage you to come back every Friday morning because I will continue on. But again, looking at that all or nothing thinking, letting that go, recognizing that life is a rainbow of colors, not just black and white, and letting that need to be restrictive or stick to this specific discipline or specific protocol is sometimes more harmful than good. The guilt related to that, I will say I talk to people every day about lifestyle, and often the conversation starts with, "I know I should be doing this, but I can't." Or or sometimes we're just avoiding these things altogether because the thought of sticking to something is so overwhelming. So again, I say leave that all alone, and small consistent steps build over time. And you know, how you feel about your health also has a positive effect. So, or a negative effect. So if you're feeling dread and doom, that is going to be more stress, and it's going to make it harder to stick to healthy habits, but also cause those stress hormones to do that damage and that in the background. So focusing on positive mindset that maybe you aren't where you want to be, but recognizing that small, consistent steps work, and recognizing that your body is amazing. It has amazing capacity to heal, and keeping a positive, optimistic outlook is really, really important and powerful in healing as well. So the way that I talk about dealing with stress, or one of the things I often recommend mindfulness, because it's something that we don't do in the Black community enough. We don't don't harness that. We do, I think that we find comfort in spiritual things, which is really important as well, and that is definitely key. But adding to that, by adding mindfulness is a really powerful tool. And mindfulness doesn't have to be meditation, although if you do meditate, that is a really powerful tool. There's many ways to harness the power of mindfulness. It can be breath work. Maybe you're not, that doesn't work for you. Sometimes people find that more traumatic. But breath work can be very, very powerful. Just counting breaths, box breathing. I think I taught that a couple of weeks ago. Um, Taking a walk in nature. I will say that with all of the technology around us, we are so removed from what is natural and what we are meant to be. We're animals. We're meant to be in touch with the patterns of nature, meant to be outside. And when we're in dependent on technology all the time, which we are, it's great, but it is can be damaging. These constant alerts and constantly being connected 24 hours a day, 7 days a week, even when we're not at work, is damaging. So whenever we can disconnect is great. So putting down that phone, really limiting the phone use as much as possible, but definitely having some protected time away from the phone. Turning off your alerts. Now, I did this years ago. We did a mindfulness challenge, and I will tell you that is life changing. To not have my phone alert, um, is it when you can pick it up when you want to pick it up, as opposed to it telling you when you should pick it up, is really powerful, because again, our body doesn't know the difference between an alert on the phone, versus being attacked by a bear or some other serious trauma. So something to keep in mind, maybe turning off your alerts on the phone, taking a walk in nature, simply just paying attention to the cues of nature. Nature moves slowly, so if we can pay attention to that just for a moment, I like to call them little joy snacks. If we can take a little moment, it can lower our heart rate. It can stimulate our calming hormones, our happy hormones. It can stimulate our vagus nerve, and it can be very powerful. Doing mindfulness, breath work, yoga, many different and so many different things. So I can post some ideas in the chat, in the details. But it's really important though to think about doing this every single day, because again, it is that consistency, because our body never takes a break from the stress, and having that break is really, really important. So what can you do every day? And it could just be 10 minutes to start. Can it just be, I love to talk about my mindful cup of coffee. In the morning when I make my coffee, I take the time to set my coffee pot up, grind my coffee grounds. I appreciate the smells and the texture of those. I watch it brew. When it brews, I enjoy the warmth of the cup. I enjoy the smell. I enjoy the whole ritual. And that's just, whatever, 10 or 15 minutes, 10 of the minutes in the morning, and sit and sip my coffee. So what can you do? What can you add to your day, that 10-minute of mindfulness, just controlled? So mindfulness is the act of paying attention on purpose without judgment. And that's really the key. I think often we are judging it. We're like, oh, I can't do that. I can't sit there still that long. I can't meditate. I can't. And it's like letting go of that judgment and just being in the moment. So as much as you could be present, that's great. So that's just my little tip for mindfulness. But um sorry about that. Sometimes taking it, yeah. So the my other tip. So so what you can start today, slowing down is a way that signals that our body is safe. And when we do that, that again is so powerful. And that supports our nervous system regulation. When we focus on doing these things, not only does it lower our cortisol, stimulate our vagus nerve, it sets our brains up for success as well. We're able better make decisions, and choose healthy choices. But we're able to think more clearly. We are able to sleep better, which again, sleep is a huge component of this. And so what can you do starting today? I will just share one other thing. So I was talking to a patient yesterday, and we were talking about this. You find that it's really hard to squeeze these things in, especially when you're a caregiver, you're a parent or a child that is taking care of your parents, or a parent that's taking care of children, or whatever it is, you're busy at work, or whatever your responsibilities are. But what I told her is one of the things that I think about is whenever I am busy or when I feel like, oh, I don't have time, stopping myself and saying, those are the times that I need it most. So often when I do this intentional slowdown, intentional break the pattern, it can be so powerful because it gives you the power back, but it immediately signals that you're safe. Obviously, if you're in an emergency situation, you have to rush, but often we're rushing in times when it's not really necessary. So simply the act of slowing down and stopping and pausing, maybe taking a few breaths, or whatever it is that you think that you don't have time to do. For me, usually it would be in the mornings when I'm trying to rush out to work and I needed to get a run or a walk in. Maybe if I just took a 10-minute walk, it would clear my brain and the rest of the day would run smoother. So think about those times when you feel like you're rushing and can you stop and pause and regroup. So this is just a few little tips for managing stress, but obviously, if you have stress that is interfering with your day-to-day life, I encourage you to talk to your healthcare provider. Sometimes talk therapy can be helpful, sometimes medication can be helpful, but it's something that cannot be ignored, should not be ignored. It's something to address. And I mentioned about joy. I'm doing a 12 Days of Joy challenge in my community, which is actually free for the month of February because I want people to be able to, manage stress and address these chronic issues that we're dealing with. So 12 Days of Joy it's a 12-day challenge where every day those prompt a little joy action to take, and the goal is that you're building learning some new tools to use later on, and that hopefully you will continue doing it. It's an opportunity to connect and lower your stress and just be more in connection with yourself. I also do one-on-one support. I do coaching calls as well as provide lifestyle medicine intensive support. You can book for a discovery call and we can talk about it. If you are struggling with nutrition, always say keep it simple. I have a free fiber guide, which is a great foundation for nutrition. So you can grab that too. The link will be in the bio below. So just thank you again for joining me every Friday morning. I'm here, Friday Morning Live with Dr. Jen. Have a great day. Thanks for watching.